Drop foot is the inability to lift the front part of the foot due to dorsiflexion weakness. The dorsiflexors are normally activated during swing, functioning to flex the ankle and allow the forefoot to clear the ground. Weakness of these muscles causes the ankle to fall into a plantarflexed position, increasing the angle of the ankle. Without compensation, the affected foot may appear floppy and drag or slap down onto the ground. We will be discussing the kinetic changes seen in patients with drop foot or general dorsiflexor weakness. We will also cover the compensations made by those with these weaknesses, as well as the orthoses available to help those avoid tripping as they bring their leg through the swing phase of the gait cycle.
In the video shown, the healthy subject experiences no difficulty using the tibialis anterior muscle to dorsiflex the ankle and raise the forefoot off the ground. However, a patient with weakness will show a decreased dorsiflexor angle. The decreased function of this muscle group will lead to drop foot during swing.
In healthy individuals, the ankle increases during swing when the tibialis anterior is acting concentrically. This allows the foot to clear the ground. The red line indicates dorsiflexion weakness. Here, the angle is reduced and the foot remains plantarflexed through swing.
Here, a patient with drop foot is seen walking without any orthotic device. Patients with dorsiflexion weakness compensate in a variety of ways. One mechanism is to increase knee flexion and hip flexor activity to prevent the foot from dragging. Faulting is another method in which the patient rises up on the toes of the stance foot, raising the body and allowing the foot to remain limp. Lastly, the patient may circumduct the hip using hip abductors. The wide outward leg swing is used to avoid the lifting of the thigh excessively. This may be seen in patients with weak hip flexors, as shown in the video of this woman walking.
In this video, we can see the difference in gait pattern while wearing the orthoses. An ankle-foot orthoses, or AFO, is typically prescribed to a patient with drop foot and can improve foot clearance during swing. The device holds the foot at a 90-degree angle, ensuring the foot does not flop when the patient walks. Some devices are made of solid plastic, while others have a hinged design. This patient wears two hinged devices. The hinge allows for increased shank rollover during mid-stance to pre-swing.
As mentioned earlier, the patient wears hinged AFOs. The hinge allows for this motion seen here.
Some disadvantages include discomfort to the patient. The device may cause the leg to feel excessively hot. Even though the AFO shown is the most lightweight device, it is still adding weight to the leg and may feel heavy. A misshapen orthosis may cause pain when a bone is close to the surface due to the increased pressure and reduced cushioning normally provided by muscles. To alleviate this, an insert may be added to the orthosis as seen in this picture.
The device may also weaken dorsiflexor and plantarflexor muscles due to decreased activity. Because the AFO is set to a 90-degree angle, the patient does not have to work to maintain dorsiflexion during swing. The plantarflexor force is reduced due to the inability to push off the ground with a joint angle greater than 90 degrees. With physical therapy intervention, the dorsiflexors can be strengthened and the effects of drop foot can be lessened.
Thanks for watching!